Hey guys, hope everybody's doing well and staying safe and sane. This week we're starting our second to our last chapter, chapter 9, and it is on late adulthood. So we're going to, of course, continue to talk about physical changes, cognitive changes, social changes, and personality changes throughout this chapter as well. So module 1 is where this video is going to pick up and cover, and then the other two videos that I'll post will be modules 2 and modules 3 respectively. So physical development in late adulthood. So most of the time when we talk about late adulthood, we're talking about changes in the physical sense, what the body is unable to do anymore. So a lot of times as we get older, people start to equate those declines in physical health with brain cells, neurons not being strong, neurons dying off, intellectual capabilities like reaction time slowing. Some older adults can't follow conversations or make coherent sentences, and of course those can be symptoms of other neurogenetic disorders as well. Energy starts to decrease. Older people just don't have the energy to continue with the same skills or the same activities as they used to, and their sex drive starts to decrease as well. However, that's not for everybody. Keep in mind, individual differences do play into account with these declines in physical health. So if older adults are very active, do cognitive engaging exercises, are still able to have satisfying sexual relationships, they will continue all of those things. They will just start to see some small dips in regards to those physical activities. But it's not to say that it just stops or that, cognitive abilities just stop. There's just more of a gradual decreasing as we get older. So with that, we have to talk about how do we study the older population. There's a special subfield in the medical community and in the psychological community where we have specialists that study medicine and psychology related to the older populations, and that is called gerontology, or gerontologists are the ones who actually study them. So they specialize in studying issues that come about with people as they age. Typically, of course, we're looking at adults who are 65 and older till death. There are a lot of studies, a lot of research that they do. So they really kind of specialize on the older population. So it'd be like if you, as a child, you went and saw your pediatrician. A pediatrician specializes in treating medical conditions of children. Gerontologists, doctors, study the medical conditions that come along with old age. So we have to look, when we talk about old age, about one's functional age. So they're kind of lumped, everybody after the age of 65, into one big group. But then it's not like everybody just gets old and they can't do things. There's different subgroups when we talk about the elderly. And so we call this the functional age. What can individuals at this age group still be able to do? So and the first one is what we call the young old. So these are 65 to about 74. They're still physically active. They can still work, hold jobs, very independent and outgoing. So they haven't really slowed down at all. Then we have the old. So these are from about 75 to about 84 years old. They start to show some health problems and a little bit of physical difficulties, but for the most part, depending on where they are, they can still live independently. They may need a walker or a cane. They may not be able to go, swim laps or walk miles anymore. They kind of have to decrease their physical activity. And then our last subgroup is the oldest old. They are about 85 and older. They're very frail. They need continuous care. a lot of these people are going to be the patients in nursing homes, assisted living. They cannot live successfully and safely independently. So those are the different groups that we talk about when we're talking about the elderly population. And again, for some, they can be 85 and still be considered young old because they're still very vibrant, very energetic, and they can handle all their daily activities themselves. So demographics of our late old, they still make up one of our highest populations in the United States and in the world. So by the year 2015, statistics says that about 25% of our population will be over 65 years old. So the fastest growing is the oldest old, which are 85 and older, because those were part of the baby boomers. And then those over 85 have doubled in the last 20 years because life longevity, life expectancy has also greatly increased because of medications, better medical care, things like that has allowed us to start living longer. And of course, this trend of our oldest old living longer is starting to occur in more of our developing countries as well as our developed countries. So science and research is kind of picking up even in our countries that don't have a lot of medicine with them or are able to treat adequately our elderly population. Those countries are starting to see their elderly live longer as well. So here's just a chart, and this is in your textbook, that kind of shows that trend to about 2050, how we see the increase of 85 plus continually living longest, just a few dips here and there. So again, medical care, nutrition, exercise, all those things contribute to that. And then of course, globally, we see the increase by 2050 as well of this elderly population continuing to live much longer than we used to see. So one thing we have to combat is ageism. Ageism is the prejudice and the discrimination against the elderly. And there are a lot of stereotypes that have been out there. And these stereotypes change from one culture to another. So there's a lot of negative attitudes about what the elderly can and cannot do. A lot of job discrimination. Once you reach a certain point or age in some professions, they will force people to retire and no longer allow them to continue to work. So again, like I said, cultural differences, more Asians and Native American cultures, they revere the elderly. They are seen as more wise, and they are really looked up to compared to other cultures. So there's two types of aging. We have primary aging, which is more universal. The changes aren't reversible. So we all get older, we all get wrinkles, gray hair, lose muscle tone. Really just kind of depends on how fit you already are. So universal means everybody experiences them. Secondary aging consists of physical and cognitive changes. So loss of muscle tone. Well, if you don't work out, your muscle tone is going to decrease fairly quickly. Cognitive changes. If you don't already participate in activities that strengthen neurons in your brain, your actual cognitive abilities are going to decrease as well. And then, of course, we have our typical outward signs of aging. Gray hair, thinning of hair, wrinkled skin because of elasticity decreases, things like that. We do start to shrink as we get older. Our bones become more brittle, and osteoporosis is brittle bone disease, as it is called, where our bones start to soften as well and can put us at more of a greater chance for broken bones as we get older. Weight-bearing exercise, using weights, is one of the greatest ways to try to combat osteoporosis. Internal aging, of course, our brains get smaller, their neurons get smaller, shrinking of blood vessels. Our digestive system starts to become less efficient, and that's why a lot of older people take Prilosec or Zantac before a meal, because they get that reflux, that GERD. Lifestyle factors can, of course, slow these processes. So if you eat healthy, take care of yourself, exercise, all that kind of stuff can improve it as well. And we know physical fitness is great for the brain, for the oxygen as well. So that can greatly help our brain and our neurons stay strong. So slowing reaction time occurs as we get older as well. So we have two different hypotheses in regards to this. The peripheral slowing hypothesis, it says that the overall processing speed declines in our peripheral nervous system. So your brain, spinal cord, things like that. And then your generalized slowing hypothesis suggests that all of our nervous system, including our brain, is less efficient as we age. And of course, if you have strokes, heart attacks, other traumatic brain injuries, these can increase the slowing of reaction time as well. Vision, so we're going to go through the senses, and I'm going to go through these pretty quickly because I think we all know as we age, our senses start to decline as well. So vision starts to come in. A lot of people get cataracts, and that's a big one where they get the laser surgery. Glaucoma, macular degeneration is where they kind of see like the middle part is blacked out or gray, and they just have their peripheral vision as well. Driving at night can be harder for a lot of older adults because their reaction time and being able to see, especially with these new halogen lights, and I'm not old by any means, so the halogen lights really mess up my eyes when I drive too, so that's a big thing. So here's a picture of macular degeneration. So you see this picture here with the little boy. You really can't make it out too well. It's kind of splotchy. That's because only the peripheral vision is still intact. So that can be a big issue, especially with driving for the elderly population. Hearing starts to decline as well. 50% of those over age 75 have some sort of hearing loss. And it really can impact social situations. If people don't feel like others can hear them or they can't hear a conversation, they will start to decrease their social interactions. Even if they have hearing aids, sometimes those don't always fit the best, or you have a lot of background noise with hearing aids, so that can be a deterrent for social situations as well. And then, of course, olfactory buds start to decline, so smell and taste decline as well. So impact of overall health, there's a lot of common physical disorders. So leading causes of death in our elderly: heart disease, cancer, stroke. A lot of those can be controlled with diet and exercise, but a lot of them are also genetically based as well. There are some common chronic long-term health conditions that start to come into place with those age 65 and older. So arthritis, high blood pressure that can become uncontrollable, as well as diabetes can come into play. Things that as we start to decrease our physical activity and maybe not have the best diets can also impact our health. There's a lot of psychological factors that come into play that maybe weren't as evident in our younger years. So major depression can become evident as we get older. Could be because of health issues, declining health, can't do the same things you used to. Could be medications that you take as a side effect, or it could be as a result of some traumatic brain injury. Friends no longer are able to, meet up and socialize like they used to, or friends are starting to die quicker just because of, that's unfortunately, part of human life. We all will die at some point. And as you live and your friends and family members die or move away, you may feel alone. So also having dementia or the beginning stages of Alzheimer's and recognizing that can also put one into depression more as well. So Alzheimer's disease is a very important characteristic that we need to talk about when we're